If you've been suffering with back pain, sciatica, or piriformis syndrome for way too long, this is your call to feel better in 15 minutes or less. If you're dealing with sciatica, that nerve pain that runs from your lower back down the center of the glute and down the leg, maybe even all the way to the foot and toes, this is how you can feel better in 15 minutes more than you have in the last 6 months. And within the first 2 minutes of this video, I'm going to show you exactly how to test so that you know you're doing the right movements for you, how to do the exercises, and exactly what sequence to do those exercises in. And I'm going to show you the most common pitfalls that my clients typically do when they're coming in for back pain treatment. And the beauty of this is that you don't need any equipment at all. You can do it from the comfort of your own home or right outside on a beautiful day. Hey, I'm Dr. Nick. I'm a doctor of physical therapy and functional movement therapist. Most importantly, I'm a former back pain sufferer. And these exercises also helped me to get out of pain so I could do things like climb those mountains back there. Now, the first question we want to answer is, do you feel better with standing, walking, or sitting? That leads us into your direction of preference. A direction of preference is a movement or position that helps you to move that pain back up the leg and towards the back. Pro tip right out the gate here. If you can find movements and positions that tend to move your pain back out of the leg and towards the back, bonus points. You're in the right direction. This is very much a red light or green light situation here. So if you find activities that move the pain down the leg, or things that you do during the day move the pain down the leg, cut those activities out, do them in a different manner. However, if we can find activities that move the pain up the leg, this is gold, you guys. And we're going to rinse and repeat that multiple times a day, not waiting for our 1 workout or 2 workouts during the day, but we're going to sprinkle that in often. So our first test is a range of motion test. And we want to see, how does bending forward feel to touch your toes? Does that hurt? Does that pull? Are you feeling it in the legs? Do you feel it in the lower back? What does that look like and feel like to you? Does it feel good? How does bending backwards feel to you? Does that hurt? Does that feel good? Is there a point of tension there? If you feel better with walking and moving about during the day versus sitting, say sitting in a couch or sitting in a long car ride, then the first test we're going to do is repeated extensions. So the way we're going to do this is we're going to take our thumbs here. We're going to find the point of pain. For most people, it's right back here on the lower back, right above that tailbone here. We want to place our thumbs right on that point of pain, eyes forward. We're going to lead with our shoulders back to the point of stretch. Now note, we're going to do 10 of these, and we want to see how we feel. Do you notice decreased symptoms in the leg? Do you notice that the pain moves? Do you notice more motion? Do we start to move forward there in any capacity? And if so, fantastic. It's a great, great sign. So here's 6. Hope you guys are doing them with me at home. 7, 8, just pushing into that stretch. Don't push into pain. Allow your eyes to stay forward. Everybody wants to tip back their head. Let those knees bend. That's totally okay. And think about the spine as a bunch of Legos. So we want from up top, moving down as we go through. So take a little walk, 10 or 15 feet, no big deal. How do you feel? Can you tell any difference? Has it moved up the leg? Has it not done anything? Has it moved down the leg? If it's moved down the leg, I want you to go to our next exercise and explore flexion. However, if it's moved up the leg or not done anything at all, go ahead and rinse and repeat. Try another set, take another walk. Can we change those symptoms? And if not, that's still okay. If you're getting more range of motion, but the symptoms are still staying, still good. Still continue to go with that. Okay, so if the standing back bends work for you, then prone press-ups might also work for you. And there is going to be a point of tension or stretch that you achieve, but this is a really comfortable position for most people. If you're in a very acute and very high pain point with your sciatica, you might need a pillow either under your pelvis or under your shins. The shins I would start with and then add under the pelvis if you feel like you need to. And usually if you're at that 7, 8, 9 points and the pain is down into the calf or into the foot, you might need that pillow under the pelvis and shins to get comfortable. And we might find that something like this is just challenging enough to get comfortable in, right? Because 8 or 9 out of 10 pain isn't comfortable for anybody. As you progress and move forward, work into getting up on your elbows. And again, small counts of 10 just to the point of stretch. That's such an important thing. We want to be non-threatening to this area as it's going through a lot. As you progress, we can move into that prone press up and allow our back to move like Legos or a slinky. So shoulder blades drop down, mid spine bends, and we come back into extension. You're just moving to the point of stretch. Allow your body to open up with time and repetitions. 10's the magic number, not 9 or 11. And we're pressing up to that point of stretch, giving ourselves a little bit of time at end range and allowing ourselves to go through that motion. This is a volume game, guys. It's not a stress game. We're not trying to hit a home run here. We're going to find that direction of preference. We're going to find those movements that help us to feel better. And then we're going to do a lot of them. So that's going to help you to move forward more so than anything else, in addition to not picking the scab. And if you aren't interested in learning more about not picking the scab, aka spinal hygiene, go ahead and check out my next video right here. So if you didn't feel better with extension, and most people do, but if that wasn't you, I want to give you the next tidbit on how to move forward with flexion. And you might notice that you feel better bending forward, stretching forward consistently, and it is okay to explore both and allow yourself to move forward that way, exposing yourself to the forward and backwards directions. For flexion, one of the things we're going to do is we're going to take that affected knee and we're simply going to pull that knee towards chest until you feel a little stretch in the glute and or lower back, and then extend back to the length of your arms. You can allow yourself to rest. This does not have to be on the floor. We can do this on the bed and make it comfortable and safe. 10's our magic number. And then we'll go ahead and do the opposite leg here. If you're noticing that single knee to chest is a winner for you, you can also try a double knee to chest. And this is hands on knees or hands under thighs. I prefer under thighs personally because I can pull not only up, but up and out. And at this top position, we're just going to the point of stretch. We want to take our breath in. So at the top, breathe in. Allow those lungs to expand. Allow your pelvic floor to fall. It's okay if you don't know what the pelvic floor is. It is the muscles that hold up your bowel and bladder. Very, very important because most of us want those muscles and everything below the belt to just work. But just like any other muscle, we can train them. And that is covered in another video series. There we go. Nice and gentle. Range of motion should be opening up. The next exercise, everybody gets that pain right in the butt, which is also known as piriformis syndrome. Sciatica is one of the classic signs of sciatica. So there are a couple ways to stretch this muscle. If that's you right there in the middle, you can push into your buttock, maybe even turn that hip inside or outside. Does that light it up? If so, that's the test. It's really, really simple there. So what we do, and this is the way that I like to do it, I bend my opposite knee to a comfortable level. I cross that leg into a figure 4 position, and then I like to pull across my body towards my opposite shoulder. So I can get a stretch right in the center of the glute there. As we breathe, we hold for 20 to 30 seconds and relax. The most common mistake here that most people make is pulling across their body, and see how my back and hip comes up there? Now I'm getting some rotation at my spine, and I actually want to just focus on my glute musculature here. So we're gonna hold that. 2 to 3 sets is ideal. Usually 1 set just isn't enough here, guys. Again, not wrong to do the opposite leg. What we're doing there is not only stretching the opposite glute so that you're symmetrical, but you're also giving great neural input to your body saying that, hey, this is okay. It's safe to do. Now, as you start to get more flexibility in that glute, you can either go toes up. I normally feel a little bit more stretch if I go rather than heel up, if I go toes up there to get just a bit more stretch there. Feels really nice. You should just be purring by this point, okay? You can thank me later or hit me up in the comments below if you are already finding value from this video. Okay, so we're already on the ground here. Now we need to talk about neural tension. Neural tension, for those of you who don't know, nerves don't stretch. This is why we don't want to stretch the nerve or stretch like into a hamstring stretch here when you're dealing with sciatica. You want to floss the nerve and move it like a piece of string. That piece of string, if you can imagine, starts at the head, comes down to the spinal cord, down all the way to your pelvis, and then down to the different nerves of the leg. And the sciatic nerve is the biggest nerve of the body. It's about the size of your pinky. Crazy to think about. But what we will do is you can take a towel and you're going to test yourself first by raising up the leg. And if you feel that stretch about here to here, somewhere in there, that is a positive straight leg raise test, especially if your hamstring flexibility on the other leg is here, right? A gross difference. Usually there's somewhere between 25 and 50, if not more, percent difference between the two legs. And we want to work towards symmetrical. We want to work towards symmetry as well as pain-free. So we're going to floss the sciatic nerve. Rest your head, place a small towel underneath the knee, lift to the point that you kind of had that straight leg raise test. So if it was right there, about that 45-degree angle, gonna stop there. 4 parts here, guys. We're going to allow the knee to bend all the way, kick out straight, toes come back, toes flex forward, knee comes back. And we're just gonna maintain the angle, okay? Kick out straight, toes come back, toes point forward, knee comes back and flexes. There we go, there's 2. 3, nice and easy. 4, and we're gonna go all the way to 10. Don't forget to breathe as you do this. Allow yourself to work through just to the point of tension at that, but all symptoms should go away as soon as you release. So a lot of times there's tension in the fascia, tension in the nerve, tension in the muscle, right? Everything's been guarding for a prolonged amount of time. And so here's a little pro tip for you guys. Sometimes people have the tibial nerve affected, so it comes down the center of the calf. Other times, many people have the superficial peroneal nerve affected. So the way that you bias that is to change the position of the ankle. Rather than just up or down, we're gonna come, when we come up, it's down and away. And then as you flex, the ankle comes up and out. Okay, down and away, up and out. And now you're biasing the superficial peroneal nerve there. So the next piece of the puzzle is testing your core. For the FMT 360 method, we want to look at the triangles of stability. And that are your shoulder blade muscles, your deep transverse abdominis and your deep abdominal muscles, your glutes and your thighs. And if you look at an anatomical chart, you can see how that goes back, front, right? Kind of creates a triangle there. And those are the big muscle groups that help us to move forward with our functional movement patterns that I find to be most helpful for my clients. Here's how you test. Now, anybody who has suffered with back pain for any amount of time has heard the advice, strengthen your core, but nobody knows what the core is or how to activate it. So here you go. We're going to keep that lower back curve with our knees bent. This should be a very comfortable position. Gravity is pushing down on me and I got a beautiful view. What we're going to do here is draw that belly button in and wide, create a wide, flat abdomen. You're going to find your hip bones and lightly press out on your obliques. So by doing that, you're getting your transverse abdominis, internal and external oblique. The only thing we don't care about right now is our six-pack muscle. We can make that pretty later. Hold this and draw that belly button, like I said, in and wide, lightly press out as we are able to breathe, as we lengthen our pelvic floor and relax there. Can we do that? Can we maintain? If so, that little isometric is such a key component that you can use when you have to sit at your desk, when you have to pick up the kiddos, when you have to lift the laundry, because life doesn't stop because we get injured, right? This is where the training becomes functional. You immediately start to use that in your daily life, especially when your back needs that little bit of extra support. The exercise then becomes, can we do what's called a dead bug? So for level 1 dead bug, we're going to keep our toes nice and soft there and raise my opposite arm and leg while not allowing my pelvis to move. We want that belt line to stay nice and steady. You should feel zero tension in the lower back here. And for a lot of people, it's hard to coordinate. We can want to do like a crunching motion because that's what we've been taught our whole life. Or it can just be hard to like get that opposite arm and leg reciprocal motion happening. And so this is what we're training. We're training that core stability with reciprocal motion because this is how we walk. As you progress, level 2 would be holding the elephant. And we can get all the muscles of the triangles of stability fired up here. We're going to bring our knees to a tabletop position, draw that belly button in wide. Like if somebody's going to drop a weight on us, we want to be able to be nice and flat and catch that. Press out on your knees. You see how I'm not creating a whole lot of motion, just activating those glutes, contracting those abdominals, driving my shoulder blades in, holding up. Imagine a tabletop comes right on top of you and that elephant is going to come and sit right on top of it. So really create that force and breathe as you create the force. And your core should not change in its contraction as you breathe. So many people have a discrepancy between what their core can maintain and what their breath is having trouble continuing to breathe as you maintain that core. Is that you? So go ahead and focus on that. That's basically a reverse plank because everything is working and firing. We want to build ourselves up maybe from 5 to 10 seconds to about 30 seconds. Where are you at today? We're going to do 2 to 3 sets of that as long as it's pain-free. And this video is all about finding where you're at, starting from there, and then building as we have different levels to our exercises. Level 3 dead bug, we're going to work on extending those arms and legs. The lower you go, the harder it is. The higher you go, the easier it is, although this is still level 3. We're again starting at our abdomen, getting that reciprocal motion, and keeping that belt line and natural lower back curve. One of the big pieces of the puzzle that I hear a lot of people do, they say to push that lower back down. When we get to squats and deadlifts, that does not serve us, so we're not going to start it now. Next, we're going to check our glutes. There are 2 big parts of the glute that are imperative for function. One is the glute maximus, one is the glute medius. To check the glute medius, what we're going to do is lift the leg up and back while keeping the pelvis steady. Can you keep the knee straight? Do you have the range of motion to get the leg behind you? Do you have the strength of the hip to maintain this position for 10 seconds? If not, you're going to start with a clamshell or a banded clamshell. You can add any form of resistance. It could be a resistance band, dumbbell, maybe it's a family member or a loved one's hand just right on the top, giving you a little bit of resistance. Just enough so that you are feeling a good contraction right in the side of your hip. Where most people go wrong with this is that they're perpendicular at the start. We actually want to roll forward to get your glute muscle right on top. We want to start with that core because it's kind of important. And then we're engaging that glute to raise the hip up, giving it a good squeeze, not allowing my pelvis to roll backwards, right? Because I don't want this to move. I want it to stay nice and steady. And then getting that contraction, contracting on the way up, squeezing a little bit more, continuing that contraction on the eccentric. So get some really good repetitions there, guys. You'd be surprised what just squeezing and adding contraction can do. When we're working on strengthening, we can work on increasing our repetitions, increasing our sets, increasing our resistance, and just working on getting volume. Once we get control of those glute muscles, our next goal is to get to a good level of volume, a good level of endurance. Because most of life takes endurance, not necessarily strength. Think about walking in Walmart or Target or going to a kid's soccer practice. It's all about getting all the way from the parking lot, all the way there, all the way back, and being able to do the task well. If that wasn't too much of an issue and the clamshell seems like it's just a little easy for you, great problem to have. We're gonna work on the side leg raise. Engaging that quad, engaging that glute, engaging that core. See how these triangles of stability all come together for these baseline exercises? And we're going to work on our repetitions, working to 2 to 3 sets to fatigue. As soon as your form starts to dip, cut it, and that's your set. Pro tip, don't forget to train both sides. Even though we have the one affected side, you are a bipedal human being. So you're going to need both legs for all the future activities. Start that now, but that could be late. For the next glute muscle that we're going to test, it's the glute maximus. And the way that we test this is we're going to bring our foot to 90 degrees, toes come down. I want you to engage your glute muscle. Yeah, one glute muscle at a time while you're on your tummy. It's actually really hard. If you're having trouble just squeezing that muscle, you might want to start here. Go ahead and touch it. It's your butt. You can touch it. Can I control just the one muscle at a time? If not, go to squeezing both muscles at the same time without the thighs, without the lower back, without holding your breath. We just want to have control of that muscle, okay? And then go to being able to do one at a time. So we're going to engage that muscle, drive that heel straight up. Can I hold it? Am I compensating with my opposite shoulder? Am I getting a cramp in my hamstring? Do I feel it in my lower back or opposite lower back? All of those are compensations, and we need to work through them. If you notice yourself compensating, if you had a cramp, if you couldn't feel your butt contracting, what I suggest is starting with a bridge or a banded bridge for a little bit more glute activation. We're going to start, as we mentioned, with that core. Draw it in and wide, find that force, maintain that breath, squeeze the glutes together, drive the hips straight up to form a straight line between knees to shoulder blades, coming straight back down. Notice my pelvis and lower back don't move here. What a lot of people end up doing, the most common mistakes here, are rolling that back to push my hips backwards. So you see all that lower back motion just to get my hips off the ground. And we want the glutes to come together towards the tailbone to drive straight up. Okay. Funny little cue I give some of my clients here. I say, imagine you're dressed up really nice. You're in a tuxedo. You're in a beautiful dress. You're wearing a gorgeous necklace. The hors d'oeuvres and the champagne are passing around. You're in amazing conversation and the hors d'oeuvres hit and you have to pass gas. What would you do? Find those glutes, get them together, right? We've all been there and done that. Drop a little smiley face in the comments below if you've had that moment. I haven't had it in a tuxedo, but I can only imagine. So we're gonna work towards our 3 sets, 2 sets of 10 with good control, right? Through the glutes, through the abdominals, driving up, getting that great contraction. If you're feeling like the hamstrings back here or the thighs on top are taking over, one of the other big points of contention is that people feel like they're pushing the floor away. Rather than pushing the floor away or with the feet, my feet are actually very light. I've got the whole foot placed flat there. And now I'm engaging the glutes before I elevate. So that's a really important piece of that puzzle. You'll switch your focus from thighs to hips. We want to strengthen the right muscles there. Remember that as you're progressing and going through today, the minimum viable dose is 2 sets of 8 to 12. However, I don't want you to stay there. I want you to work on progressing these activities. So go ahead and save this video. You're going to work towards 3 sets of 15 repetitions to give you the proper amount of endurance to handle life. That will make so many things more comfortable and pain-free as you move forward in this journey. Just trust me. And then you can also move through the different levels of the activities as you see yourself progressing. And that always feels really, really good. So if you can do the bridge or the banded bridge, no problem. Go ahead and work into your prone hip extension. If we don't quite have that hip extension range of motion, you can always add a pillow under the pelvis. Sometimes we lack the range of motion, but have the strength, and that's okay. We can give ourselves a little bit of a cheat as we work through some of those other issues that are contributing to the radiculopathy. So pro tip here, as you are getting up, make sure to do it with proper spinal hygiene. We're going to push up into our tabletop position, bring our hands back to our thighs, core engaged, obviously. Throw a leg up to the lunge position, both legs push straight up. All right, that's it, you guys. You found your direction of preference. You were able to move that nerve pain out of the leg and back towards the lower back. We found a little bit of relief from our piriformis stretch and our sciatic nerve flossing. And then we did a little bit of core activation, just enough to turn some of those muscles on. As you take your walk around your house, how do you feel? Go ahead and drop that in the comments below, and I can't wait to see you guys on the next video.